protein rich diet will ensure that the overall outcome of the patient is better. And once we educate them that this is what is going to actually help them in long run, I think the acceptance will be better, especially when you take in consideration of alcohol related liver disease. Nutrition is the only proven treatment to actually reverse a disease which is at a reversible stage. What are the most commonest myths which you have encountered when you're counseling patients on taking some protein rich diet?
If it is a non-vegetarian, the commonest myth is stop all the non-vegetarian food, move on to vegetarian food, which is very difficult for the quantity to achieve the protein. If I take protein, I will end up in the ICU. So here the quality of the protein is important, as you emphasized on whey. So in these obese patients, how do we counsel them and how do we educate?
For them, weight loss is important in terms of losing fat. They should not lose muscle. Carbohydrates release energy in a quicker manner, fats release energy slowly, and proteins take longer time to release energy, and they make the body utilize energy to digest it. So hence in that situation, in obese individuals, you ask them to reduce the calorie intake by reducing the carbohydrate intake and keeping the protein on the higher side. Patients in the ICU, how do you manage them, doctor?
Patients in the ICU, their intake is already poor. We ask them at least to keep sipping on the supplements, at least if they are able to take nearing the 1 gram is sufficient when they are in the ICU. So supplements which can have both calorie and protein are very important for our sarcopenic patients. For our obese, we need only protein.
Also, that one education which we can give is not to mix the supplement along with the food. In the sense, they can break their meals 6 times in a day or 8 times in a day. Take food, walk around, do some physical activity, have some protein supplement. Again, do the same. As a process, that they can keep doing this repeatedly, they'll be able to meet their calorie requirement as well as their protein requirement. Because definitely with onset of liver disease and progression of liver disease, hunger is going to come down, appetite is going to come down, both of them are slightly different, and the desire to perform physically is going to come down. This is our duty to educate the patient that not all proteins are the same. They have to choose it rightly, or what is prescribed, they have to take it religiously.
And as you said, liver disease comes along with the metabolic parameter. So whether it's a diabetes or hypertension. So when it is diabetes, we look into supplements which also do not elevate their sugar levels. Supplements either prescribed by a clinical dietitian or a doctor is very much specific, disease specific. So it's better to go with these supplements.
Basically, the concept of liver disease is no fasting, no feasting. So don't feast, don't fast.